like and subscribe. Now, doctors of Reddit, what's something you've had to tell a patient that you thought for sure was common knowledge? Have had to inform a few male patients that the condom only goes on the shaft and should not be pulled down, to include covering of the testicles. I once had to use the word dick instead of penis because the patient did not know the proper term for his genitalia. How a shorter / fatter 5ml oral syringe held more volume than a skinnier and longer 1ml oral syringe. How does this hold more liquid when it's shorter? Also, I've seen almost every incorrect way to use an inhaler, upside down being fairly common. People taking birth control pills only on the days they have sex. I no longer assume anything is common knowledge. I'd rather someone be offended that I explain something basic than to have something awful happen because I assume the patient knew something. Isn't this a key part of developmental psychology? I forget the term, but knowing that different shapes of objects can have greater or less volumes. I'm not a doctor, but I'm a nurse. I had a patient come in for an STD check. She was very upset and continued to tell me that she only had one partner. Progressing through my assessment, she further divulged that even if he was sleeping with other people it shouldn't matter because he uses a condom every time and he makes sure to wash it thoroughly after every use. I asked what she meant when she said he washes it after every use. She explained that he washed the condom with hot water and soap before he used said condom again. I had to explain to her that condoms are a one-time use product. She had no clue. Out of everything I've read so far, it's always the stuff that comes back to horrible sex ed that terrifies me the most, and this is probably one of the worst. My dad is a family doctor in the States. A woman came in for a well baby check with her 6-month-old, and she had what looked like chocolate milk in the baby's bottle. So he started explaining to her as kindly as he could that she shouldn't be giving her baby chocolate milk, at which point she interrupts him and says, "Oh, that isn't chocolate milk, it's coffee. He just loves it." If you're going to put it in your A, make sure it has a flared base or is attached to something you won't lose your grip on. Corollary: if you've already lost something in your A, don't lie to the triage nurse and then medical team. While your story is usually amusing, we don't really care how it ended up in there. Pediatric nurse here. I've told more than one parent that their infant should not be drinking drive pepper out of their bottle, or any other vessel for that matter. Viagra does not prevent STDs or pregnancy. Not a doctor, but a paramedic. During clinical time in the year, 17-year-old girl came in with a bloody rectum/anus. Apparently she wasn't wiping after using the bathroom, and it was basically really bad diaper rash. So the nurse had to call social services and explain to this girl proper wiping. How? What? I'm with you there. Can you imagine how bad her A itched? Constantly. The smell. Her effing underwear. Her confusion as to what that roll of super soft paper is beside the crapper in public bathrooms. Not a doctor. RN in the ICU. I've seen some really stupid people over the years, but a few weeks ago a patient's family member got into a verbal altercation with me over the fact that I was trying to freeze his mother to death. He kept pointing to the digital thermostat displaying a temperature of 23 degrees Celsius. We are in the US. BTW. When I gently explained to him that 23°C is not at all cold, he just kept pointing to the display and shouting, "You don't think 23 degrees is cold? It's 23 effing degrees in here," and acting insane. After multiple attempts to explain to him what Celsius is by myself, the charge nurse, house supervisor, and security, we finally gave up and had him escorted out. He was a man in at least his late 30s who graduated high school and had never heard of Celsius and Fahrenheit. He literally thought we were making it up in an attempt to conceal my efforts to freeze his intubated, critically ill mother to death. Another vet here. Dead bodies decompose. If you leave your dead dog euthanized in the back of your car on the hottest day of the year, don't come crying to me when its belly fills with putrefying gases and bursts. Demanding I cover the costs of rear falstering your car might be considered a little rude as well. The mental images, enough, but to have the gall to demand you fix their car. No, they had the gall alright. A hospital is open 24 hours a day 7 days a week for medical emergencies. So, the next time you have a stroke on a Friday, come in on Friday and don't wait for the weekend to pass. that a child cannot have inherited any genetic traits from someone the mother has previously been with. Only one man is the biological father. My wife and I were trying to get pregnant, and due to possible complications we were talking to our obstetrician. Towards the end of the visit, he tells us, in all seriousness, just so you guys know, you have to stop using condoms if you want to get pregnant. We just stare at him a bit and say, "Oh, obviously," and he just shakes his head and says you'd be surprised. There's been a few couples that really didn't realize that. My parents were also having problems getting pregnant, and their doctor explained that you need to have vaginal sex, because he'd had patients who were doing anal and wondering why it wasn't resulting in pregnancy. So did your parents ever get a kid? You're still sexually active, even if you are just on the bottom every time. I see the confusion here. In many languages, including French and Spanish, being a top is called active, and being a bottom is called passive. When you asked if he was sexually active, he interpreted it as meaning, are you sexually a top? Are you sexually active? No, I just lie there. A nurse here had to explain to a 27-year-old female that this bleeding she was having for a week every month was normal and why she had 2 children. BTW. My mother is a nurse and has been for over 25 years. The only story of hers that makes me sick is the story of a man who could not afford Viagra, so he reasoned his cork gun should do the trick. Right, it had stayed there and keep him hard, so he put the tip of the gun in his urethra and filled himself up. Long story short, don't do that. Don't, for Christ's fine sake, ever do anything even remotely like that. Podiatrist buddy told me this one lady has to have foot amputated and is given waiver forms to sign pre-op. Buddy asks if she needs time to think about it. She's very nonchalant and doesn't seem to care much what they do. He gets suspicious and probes a bit as to why she's not more concerned. She says she gets that they have to operate and it's okay because the foot will grow back. HD then has to explain she's not a salamander. Things get a bit more serious. Wow, good thing he checked. I can see a lawsuit forming. He didn't tell me it wouldn't grow back. I'm sad he checked. A story about a woman saying that in court would be the highlight of a lawyer's career. Not a doctor, but a nutritionist. I work with a lot of different patients, and I have tons of stories about food stupidity. Had a lady have bariatric surgery. Your stomach gets surgically stapled smaller, and her mother kept trying to force her to eat real food the day of the surgery. When she was on a liquid diet she would eat it, puke, rip her stitches out, repeat. We had to ban the mother from seeing her, because she would literally blackmail and guilt trip this poor lady into eating a whole pizza, barf it all up, because her poor post-surgery stomach couldn't handle it, and end up ripping out stitches and causing enormous pain, because her mother was positive that she would die if she was on a liquid diet for a couple days. Another lady I was seeing for clinicals was diabetic, and she would come in every week with stupid high blood sugar levels, 250, 560 ish. Not knowing why they were so high. She kept a record of everything she ate, and all her food intake seemed fine. One day, her husband came with her, which was weird, and he ninja slipped me a note while shaking my hand. It read, "Ask her about the Quick Trip slushes. She doesn't believe me that they have sugar in them." So I asked her if she was having any soda, lemonade, tea, ice cream, shakes or slushes, and she told me like a light bulb had gone off in her head. Well, I have been drinking about 3 of the 48 ounces Quick Trip slushes every day for a while now. They're just so good, and they aren't food or drink. They're slushes, so they don't have any sugar in them, and I don't need to record them. It was so hard to convince her that those are so full of sugar it isn't even funny. But seriously, 3 a day on a type 2 diabetic. It was one of the stupidest things I have ever heard in my life. Good on the husband that he cares enough to try to explain, and when his words fail, having you do it without embarrassing her. For God's sakes, don't put butter on a burn. No, those aren't tumors on your dog/cat. Those are nipples. Yes, males have nipples too. A nursing home called 911 for a patient who was having difficulty breathing. When we arrived, a PA was standing in front of the patient vigorously fanning the old lady with her hands. She looked at us and said, I'm giving her some oxygen because we couldn't find a portable O2 tank and keeps flapping her arms. Remember, this is a physician assistant, probably making 100k a year. I informed her that she could stop now, and my partner and I did our best to wait until we were outside to burst out laughing. Some people don't handle stress well. I volunteer as an emergency first responder, but one of the funniest cases I've seen of this was out of uniform in an airport. A larger gentleman who suffered from COPD had taken a 6-hour flight. Upon getting through security he had collapsed and was having difficulty breathing. The first person on scene to help the guy was a firefighter. I was second on scene. Younger and smaller than the firefighter. I'm 6'3" and not skinny. This guy was just huge, so I'm letting him take lead as I run through making sure EMS is on the way, checking the guy's vitals, stabilizing his head and neck. Big guy went from conscious to unconscious quickly and fell straight down, and getting a history from his family. In the meantime the firefighter's kinda starting to panic a little. He may have been new, or just the fact that he was out of uniform and not expecting it through him. Either way, as the man regains consciousness and I start running through a quick GCS test, which involves me and the gentleman talking to each other and treating for shock, the firefighter tries to retake the guy's vitals. He fails to find a pulse. Understand at this point I'm communicating with the patient. He's not completely lucid, but he is speaking to me and groaning. Having failed to find a pulse, the firefighter assumes this gentleman is in full-on cardiac arrest and begins to attempt to apply a lead to his chest. I say attempt because, along with being large, this gentleman was somewhat hairy. Now in any first aid course for anyone, that involves teaching one to use a need. One of the things you cover is that the razor in the kit is there in case you need to shave someone. The firefighter, having failed to realize that talking probably means the patient isn't in cardiac arrest and that he is having trouble getting a pulse because the patient is larger, then fails to shave the guy's chest. This leaves the patient with the 2 contact pads hanging off of his chest hair, but very much not in any way contacting his skin. While I've just started to realize what the firefighter was trying to do, at that point, fortunately, an older woman arrives and identifies herself as a trauma nurse, who are, by the way, just about the best people to have on your side if something like this happens. She tells him to go talk to the family, takes lead, and everything goes smoothly from then until the airport medical folks show up and take over. Unfortunately, I'm having trouble not laughing the whole time at the image of the firefighter staring intently at a need that can't possibly give him a reading on the condition of the now conscious and lucid patient. TL. Doctor, even people who should know better sometimes lose it under stress. Had a lady measure her baby's temperature by preheating the oven and putting one hand in front of it while the other hand was on the baby's forehead. She told the nurse her baby's fever was about 250 degrees. How high is your baby's fever, ma'am? I believe it's about warm. Oh god. For a second I thought she was going to put the baby in the oven. Still scared for that baby though. I had an old lady come in with a massive bleed in her brain. She was pretty much gone. I had to explain to her tearful son that there was nothing we could do. He said that he loved his mama and he'd give anything for her, so he asked us to give her his brain for a brain transplant. I actually was left speechless for a minute and then had to spend another 20 minutes explaining why that was not possible. Mom brought her kids to the ER after they ate all of their Halloween candy because they had tummy aches. They were still eating Reese's peanut butter cups when they were in the exam room. I had to explain to her that they need to cut back on the candy, and she looked at me like I had 3 heads. To reverse this, my mother brought me to the doctor on Halloween. When I was 8, I had serious stomach pain. He said I probably had too much Halloween candy. 3 days later in the emergency room, yup, it was appendicitis. There's no wrong way to eat a Reese's. If you're Canadian, you probably remember the Sunday night sex show with Sue Johansson, an adult male called in complaining about a horrible smell coming from his penis and how he thought it was some kind of infection. So, Sue quizzes him on his self-hygiene, and after she mentions pulling back the foreskin when cleaning, the guy stops her and asks her to repeat what she had just said. He had never learned how to properly clean himself and had never retracted his foreskin before because it hurt. Seems the foreskin had bonded itself to the glands with smegma. for almost a month. My friend had random pains. Bruises started showing up randomly. He looked as hen, and what we first thought was him being lazy was actually him not having any energy. Finally his girlfriend got him to agree to go to the doctor, who sent him to the where it took several doctors to figure out what was wrong, either because none of them had actually seen it in real life before, or they didn't think someone could be that stupid. Quote the doctor, "You have scurvy. Eat a refine orange." My freshman year of college there was apparently a scurvy epidemic on campus, at least bad enough to make the campus daily, because some kids thought pizza and Mount Dew was a sufficient diet. That was pretty much Steve. His girlfriend had a car, but no sense of direction. Steve didn't have a driver's license, but knew how to get around. Together they held down a pizza delivery job. That a PhD isn't that kind of doctor. Please don't show me that rash. No joke. A panicked 29-year-old came to the office for corn in his stool. He genuinely thought something was wrong. Paramedic here. Have informed numerous people that pouring Gatorade into the unresponsive diabetic's mouth is not a good idea. Get me 2 units of Gatorade. Stat. We are not gonna lose another one, damn it. Get me 2 cc's. And by cc's I mean chocolate cupcakes. But it has electrolytes. It's what plants crave. My mother, who worked as a pediatric nurse, she had a mother whose child was putting on a startling amount of weight. This was bad, since the patient's mother was obese and had diabetes, and they wanted to control weight gain for baby. So they went through the feeding schedule. Baby was due for a bottle during the checkup. The mother whips out a bottle during appointment. My mom is startled to see the milk is bright fine pink. She asks why is the milk bright goddamned pink. The child's mother explains that her kid prefers the milk if it has strawberry quick mixed in, and drinks more milk. The mom didn't get the connection between quick and weight gain. TL. Doctor, don't feed your child the betas. It makes them fat from the start. I doc here. Just today, I had to tell a patient that no, you should not attempt to continue wearing a contact lens that was dropped in the toilet. In a free medical clinic I had to tell a mother that she should be brushing her 4-year-old's teeth. The daughter came because her throat hurt. After opening her mouth using a tongue depressor to see her throat, the daughter squirmed like 4-year-olds are prone to do. The tongue depressor hit her gums. Pus flowed everywhere. The child wound up having to be put on penicillin before having every last tooth pulled due to severe infection. Poor kid. That sounds like a bad time. Absolutely. The mother was about 20, still had all her teeth, though I have no idea how. Stories like this are confirmation that I would not be able to handle working as a healthcare provider. My little cousin had dentures at 3 or 4 because all his teeth rotted out, not even being raised by some young, dumb mom. He's with his 50-something grandmother. I'm pretty sure he got orange juice and Kool-Aid at the same time he got off formula. And this was before they accidentally ran him over with a lawnmower and had to get most of his foot amputated. Poor guy. Some people shouldn't have kids or grandkids. That they were 8 months pregnant. I used to work for a small town internal medicine / pediatrics office as a receptionist, and we closed for lunch for 2 hours, which in actuality was for our 2 doctors to get to the hospital and check on their patients' rounds. One day, one of the doctors didn't have any patients to check on, so he took a drug rep up on his offer for lunch and invited him in. I was working on a reorganization project for the files and decided to work through my lunch, so we were the only ones there. A guy came to the door that wasn't anyone I recognized and knocked and asked me to let him in. I said sorry, we open again 1:30. He started crying and I ran to the door and asked what was wrong. He said I don't know and pointed at the car. A woman was crying and hunched over in the front seat. I told him to keep her calm and ran back inside to grab my doctor. He grabbed a wheelchair and ran out to get her. The drug rep asked if I knew where the nurses kept supplies, and I got the key to their cabinet. When the doctor came in, he was visibly upset, but asked me to get our minor surgery bed ready immediately and asked for the nurse's key. Our drug rep said, "I'm in. What do you need?" "Doctor, I'm a current licensed RN." He said some stuff and had me assist with getting the lady on the table. Drug rep started forth and had me hold the saline bag while he gave a dose of painkillers. Once he finished, my doctor told me to help undress the woman, and I asked her if she wanted the man in the room. She said yes, and I undressed her bottom half. As I did, I noticed her jeans were wet. My doctor noticed me and the liquid at the same time and said use gloves. As I pulled off her jeans, we could tell there was a lot of blood. Doctor grabbed the saline bag and asked the drug rep to call an ambulance. As I finished pulling off her jeans, I noticed a protrusion from her underwear. The doctor noticed at the same time and said you talked to dispatch and called for the rep. I explained the situation and they said, did he say live birth or abortion? I yelled birth or abortion. Wow, I was stupid at 20. She freaked. Her husband started crying and doctor said possible spontaneous or birth. Likely spontaneous, I told them, and started to hear the sirens. The rep met them at the door to explain, and it turned out she had her tubes tied 10 years prior in Mexico. That didn't take. It turned out it was a stillborn at 28 weeks. She had no idea she was pregnant and had 4 kids already. They were devastated. She was already mostly there. The protrusion I saw was the head, so they had her deliver in our office before taking her to the hospital. As our staff came back from lunch, I met them outside to explain why an ambulance and fire truck were there and that they could go home because we were closed for the day. I called our afternoon patients and rescheduled. The other doctor made house calls to anyone that he or they felt couldn't wait. It was awful, but it happens. And I hate it when people think that people are just so stupid for not knowing. I once had a patient with a cancer diagnosis completely depressed about not being able to see their family anymore. I was confused because I had spoken with this individual's spouse and extended family who seemed supportive. There wasn't any indication of family problems, etc. It turns out that this individual thought genetic and family history had meant something similar to contagious, leading them to the conclusion that one should stay away from loved ones, lest it be spread through the family. That was one clarification I was so happy to give. Wow, that's actually really sad. At least you were able to correct them. My mom was a radiologist, retired now, and she regularly had to explain to patients that if you were too fat to be put in the scanner, you could not be put in the scanner. Along similar lines, if you weighed more than the table could support, it would be listed on a sign in big letters. They could not put you on the table. At our hospital/university they sent fat people to the zoo. Their scanner for large animals can be used for humans too. Oh god. I can just picture that embarrassing conversation with the patient. So this happened when I was a family doctor. I got a call in the middle of the night. I was on call from a very distressed new mother. She said her newborn was projectile vomiting with every feed. Projectile vomiting can be a worrisome finding in a newborn, so I asked her to meet me in the ER right away. When I saw the baby, he was smiling, happy and in perfect good health. The mom assured me that he vomited with every feed, so I asked her to feed him to let me see what happened. She did, and as soon as she finished, the baby started to fuss and spit up the milk. I asked was this what she had been seeing. It was. So I asked her if she ever burped the baby. She looked at me puzzled. She had no clue about burping. She said she thought it was some TV thing. I assured her it was a real thing, and at 2 AM taught her how to burp a baby. I asked her to follow up with me in a day or two. She came in and said, "You are the best doctor ever. That burping thing you taught me is like magic. Now my baby is happy all the time." So there you go. Someone who did not know about burping a baby. Edited to at kidshealth.org/parent/center/newborn_care/burping.html. NB I'm not sure if this is a mobile friendly site, not just Google burping a baby. My sister is an embryologist, and she has had many Indian couples come in thinking that women are impregnated by urine. I have a friend from Pakistan who had an arranged marriage when she was 19. When she got pregnant shortly after, her husband had to be the one who explained to her where babies come from. He also had to explain that animals also have sex to make babies. Don't pull out the knife, not until you're in the hospital, and even then, wait for someone else to do it. I doctor here. I've got two main ones. First, when I ask them to follow a light as I move it around to check their eye movements, I'm asked with just one eye or both. I really want to say, if you can do one eye at a time, I will be amazed. Second, the prescription cannot run out of your glasses. They don't need a refill. You didn't clean them too much and wash out some of the prescription. You just need new glasses.